Now, somewhere in the Atlantic Ocean right now, there is a cruise ship that nobody will let dock. 147 passengers and crew are trapped at sea. Now, 3 people on board are already dead, and 1 person is fighting for their life in an intensive care unit in South Africa. A passenger flew from Johannesburg, which is a city in South Africa, to Amsterdam and was pulled off the plane before takeoff because she was too sick to travel. And the reason nobody will let this ship dock is that there is a virus that most people have never heard of. That is Hantavirus, that was found on board. And in the last 72 hours, or even more, it has triggered an international health alert coordinated by the WHO, activating emergency response teams across 5 countries and putting the entire global health community on watch. Now, today I'm going to tell you everything that you need to know about this virus. What is this virus? Where it came from, how it spreads, what it does to your body, whether you should be worried about it or not, and most importantly, what you need to know to protect yourself and your family. Now, this is breaking news, of course, and I want you to have the right information, not the panic, not the rumors that are flying out there, not the WhatsApp forwards that you keep on receiving on different WhatsApp groups. Now, the real medical facts is what I'm going to share through this video from your pharmacist, of course. So stay with me until the end to get educated about hantavirus. Okay, before we proceed, I have to say this, that I checked my analytics and 98% of you have been watching without subscribing. And of course, you know who you are. I would like to ask that you hit that subscribe button right now before we proceed, and also tap the bell and drop a comment telling me what health topic you want me to cover next. I read every single one of your comments, and I'll try as much as possible to respond to all of them. If you're done, that is perfect. I'm Libeya Bethwel, I'm your pharmacist, and I want to be very clear about why I'm making this video today. Is not to cause panic, not to create fear, but because a dangerous virus is making international headlines right now, and I believe you deserve a calm, clear, and medically accurate explanation, not speculation and misinformation. So let us start from the very, very beginning. And let me tell you exactly what is happening right now, because the story itself is quite remarkable. Now, on the 1st of April, 2026, a Dutch cruise ship called the MV Hondius departed from Ushuaia, that is the southernmost city in the world, located in Argentina, and on board were 147 passengers and crew from 27 different nationalities. Now, this was an expedition cruise, the kind that travels to remote, wild places most people never see. Now, the leading hypothesis, confirmed by the Argentine investigators on the 6th of May, is that the index case, or the first case, the first person to get sick, contracted the virus while birdwatching in Argentina before boarding the ship. Now, think about that for a moment. Birdwatching in a field, in nature, and somewhere in that environment, in the dust, in the grass, in the air around rodent droppings, a deadly virus was waiting. Now, by the 11th of April, a Dutch passenger had died on board. His body remained on the ship for 2 weeks until the vessel reached St. Helena, a remote British island in the South Atlantic, where 30 to 40 passengers were allowed to disembark. Among them was the deceased man's wife, who was already showing symptoms. Now, she boarded a flight to South Africa. She deteriorated mid-air, and she was taken to the emergency department upon landing, and she died, of course. Now, laboratory testing in South Africa on the 2nd of May confirmed hantavirus infection, and the world sat up and paid attention. Now, the ship then tried to dock in Tenerife, that is in the Canary Islands, but the regional president of the Canary Islands refused, citing fears for its population, particularly given their memories of COVID-19. Now, the WHO responded publicly saying that Spain had a moral and legal obligation to assist the passengers, many of whom were Spanish citizens. Now, as of today, the ship is anchored off the coast of Praia, which is in Cape Verde, with around 150 people still on board. Now, there have been 3 deaths so far, 5 confirmed cases and 3 suspected cases. And a new case has been identified in a passenger who returned to Switzerland and was found sick after responding to a follow-up email from the ship's operator. Now, this is a live, evolving international health event, and it involves Africa directly, with cases confirmed in South Africa, of course, a ship anchored off the West African coast. We've talked about Cape Verde, and the African CDC is monitoring the situation in real time. Now, this is why you need to know about Hantavirus today. So what exactly is this particular virus that you're talking about? Hantavirus is not new. It has existed for a very long time, and we just did not know what to call it. Now, scientists note that hantavirus dates back to the Korean War in the 1950s, when soldiers began falling mysteriously ill with severe kidney failure, and it was classified by the WHO in 1987, but it was not until a 1993 outbreak in the United States that hantavirus pulmonary syndrome, that is the lung-destroying form of the disease, was fully discovered and documented. Now, hantavirus belongs to a family of viruses that are called Hantaviridae, and there are multiple strains of this particular virus. And here is the crucial distinction that explains everything happening on this ship right now. Now, hantaviruses, they cause 2 distinct clinical syndromes. In the Americas, infection leads to hantavirus cardiopulmonary syndrome. That is in the Americas, which is a rapidly progressing condition that attacks the lungs and the heart. But in the Europe and Asia, the same family of viruses, they cause what we call hemorrhagic fever with renal syndrome, which primarily attacks the kidneys and blood vessels. Now, the strain involved in the current outbreak is called the Andes virus, and this is the strain that makes the outbreak particularly alarming to scientists and health authorities worldwide. Why is this so? The Andes virus is the only known strain of hantavirus that is capable of human-to-human transmission, although this remains extremely rare and typically requires close and prolonged contact. Now, every other strain of hantavirus spreads only from animals to humans. The Andes virus, under specific conditions, particularly close contact, can spread between people, that is from person to person. Now, that single fact is what turned a medical case report into an international headline. Now, this is the section I most want you to pay attention to, because this is where most of the information is spreading faster than the virus itself, and I want you to pay attention. Let me be very clear and very precise and very honest with you. And I'll begin by looking at how hantavirus normally spreads, that is from animals to humans. Now, transmission of hantavirus to humans occur through contact with contaminated urine, droppings, or even saliva of infected rodents. Now, infection may also occur through rodent bites, although it is less common. Now, the primary route is inhalation. When rodent droppings or urine, when they dry out, they can become dust. When that dust is disturbed, when you sweep a room, clean a shed, move old boxes, walk through long grass, tiny particles, they become airborne. And if you breathe them in, the virus can enter your lungs. As one expert put it, rats jump on ships or are carried onto them in cargo. They poop and pee. Air currents aerosolize it, carry it, and it can get in the lungs, causing serious pulmonary illness. That is what one expert said. Now, activities that increase exposure risks include cleaning enclosed or poorly ventilated spaces, farming, forestry work, and sleeping in rodent-infested areas. Now, even clean homes and cabins can pose a risk. If rodents are present, the virus may be as well be present. That's an important point for you to take note of. Now, the question everyone is asking, does it spread like COVID, like the flu? A common misconception is that hantavirus spreads like influenza. Now, this is not accurate. You have to inhale virus-carrying particles released when rodent-contaminated materials are disturbed. And even then, the virus only survives on surfaces for a few days. Aerosolized viruses like measles or influenza, they stay in the air much longer and transmit more easily than hantaviruses. So no, this is not a virus that spreads through casual contact, through breathing the same air as an infected person in a shopping mall, or even through touching a surface and rubbing your eyes. It doesn't spread like that. So a question you could be having is, what about the Andes virus and human-to-human transmission? How does it happen? Now, human-to-human transmission has been documented only for Andes virus, and it remains uncommon. Now, when it does occur, transmission between people has been associated with close and prolonged contact, particularly among household members or intimate partners, and appears most likely during the early phase of illness. Now, most hantaviruses, most of them, they do not transmit from person to person. The exception is Andes virus, which has been, of course, shown to spread between people, typically through close and prolonged contact, as I've said, and it is not yet known whether transmission in the current outbreak occurred through environmental exposure or between individuals. It is not yet known. What this means practically, you cannot catch hantavirus from a stranger on a public means of transport. You cannot catch it from someone coughing near you at the market. Now, the risk profile is fundamentally different from COVID-19 or even influenza. The risk profile is fundamentally different. Now, the WHO currently assesses the risk to the global population from this event as low. And I want you to hold on to that. Low global risk. Now, this is not a pandemic. It is not COVID. This is a serious contained outbreak that science is actively managing. Now, let us talk about what actually happens inside your body when you are infected. I want us to look at that because understanding this is critical, not just for awareness, but because the speed at which this disease progresses is what makes it so dangerous. Now, the incubation period is what we look at first. That is the silent phase of this disease, the incubation period. And in this phase, symptoms usually begin between 1 and 8 weeks after exposure, depending on the type of virus. Now, the incubation time is usually around 2 weeks, but ranges from 7 days up to the 6 weeks there. This means someone can be infected, feel completely normal, and unknowingly expose others for up to 6 weeks. Now, this is exactly why contact tracing is so complex in the current outbreak. Passengers had been traveling for weeks before anyone showed any symptoms. Now, there's stage 1, which we call prodrome, between days 1 to 5 of symptoms. And initial symptoms typically include fever, headache, muscle aches, and also gastrointestinal symptoms such as abdominal pain, nausea, or vomiting. Now, here is the terrifying truth about this stage. It looks like malaria. It looks like the flu. It looks like food poisoning. Now, in Kenya and in Africa in general, a patient presenting with fever, muscle aches, headache, and nausea will almost certainly be treated for malaria first. And the precious days lost in that misdiagnosis can be fatal. And then we have stage 2, which is the cardiopulmonary stage, that is the crisis stage. And this is where hantavirus separates itself from every common illness that you know. Now, after the initial symptoms, patients progress to pneumonia. It's acute respiratory distress syndrome and shock. And this happens rapidly. Now, rapidly means within hours, or not days, but just hours, and everything builds up. Now, the lungs begin to fill with fluid. The heart struggles to maintain pressure. Oxygen levels also plummet, and the patient, who may have felt only mildly unwell 24 hours early, is suddenly in a life-threatening emergency. And this is what happened on the ship. Passengers went from feeling a bit feverish to being in respiratory failure within days. And one person died before the ship even reached the land. Now, severe cases rapidly deteriorate and become life-threatening. At least 4 of the confirmed and suspected cases on the ship rapidly progressed to pneumonia, others to acute respiratory distress, and others to shock. Now, we have what we call the kidney form, or what happens in Europe and Asia, the kidney form of the disease. Now, for completeness, the strain found in Europe and Asia, it behaves differently. So instead of attacking the lungs, this strain attacks the kidneys and blood vessels. And when it does that, it causes bleeding, kidney failure, and dangerously low blood pressure. And this is called hemorrhagic fever with renal syndrome. This is in Europe and Asia. The Andes virus involved in the current outbreak causes the pulmonary form of the disease. That's the lung-attacking version. And that is the one that the world is watching right now. Now, I need to be honest with you about something, because this is where your pharmacist or your pharmacist or your doctor training becomes most important for healthcare professionals who are watching this video. There is no license-specific antiviral treatment and no vaccine for hantavirus infection at the moment. Now, care is supportive and it focuses on close clinical monitoring and management of respiratory, cardiac, and kidney complications. That is how management is structured. And let me say that again clearly. There is no cure, there is no specific antiviral that can be given for this disease, and there is no vaccine. So what medicine can do, and it matters enormously, is support the body while the immune system fights. Now, the most effective intervention for severe cases is ECMO. And ECMO, for those who don't know, is extracorporeal membrane oxygenation, which temporarily takes over heart and lung function to give the body time to recover. And this intervention decreases mortality from 50% down to 20%. And unfortunately, ECMO requires a well-resourced intensive care unit. And this is the part that should concern every African country. ECMO is not widely available in most African hospitals. The technology is extraordinarily expensive and requires specialist teams to conduct. And doctors must also avoid over-administering fluids, as the body's low blood pressure can cause fluid to accumulate in the lungs. Steroids should not be used, as they can disrupt the delicate balance of inflammation needed for an immune response. And this is critically important medical knowledge for healthcare professionals, because the instinct in many clinical settings when a patient has low blood pressure is to give fluids aggressively. In hantavirus, that instinct can kill the patient faster. Now, the honest truth is this: the survival of a hantavirus patient depends almost entirely on 2 things: how quickly they are identified and how quickly they receive intensive support care. Now, early detection is everything, and that starts with knowing what to look for. And that ushers me to the next session of this particular video, which I'll be giving you a clear practical symptom guide, because this is what your family needs right now. Now, early symptoms that you need to look out for, the ones that look like nothing serious, is what I would like to highlight. When you have that sudden high fever, severe headache, intense muscle aches, especially in the thighs, hips, and back, chills, abdominal pain, nausea, vomiting, or diarrhea, these symptoms begin between 1 and 8 weeks after exposure to infected rodents. Now, the red flag symptom that you need to look out for, the ones that mean go to the hospital immediately, include difficulty breathing, chest tightness, a dry, non-productive cough that develops after the initial fever, feeling like you cannot get enough air, dizziness or lightheadedness. This signal that the virus has entered the cardiopulmonary stage. You do not have time to wait and see. When you see such, rush to the hospital. The critical rule for Kenya and Africa an advice is, if you or someone you know has recently been in an area with rodent activity, it's clearing land, cleaning a store or barn, or sleeping in an older building, spending time in rural or forested areas, and you develop a sudden high fever with severe muscle aches, please do not assume it is malaria and self-medicate. Go to a hospital. Tell them about your environmental exposure. Ask for proper differential diagnosis. Now, the window between symptom onset and respiratory failure in hantavirus can be as narrow as 24 to 48 hours. And that is your window. Do not waste it on home remedies. Now, the question I know every Kenyan watching right now is asking, should I be worried here in Kenya about this hantavirus? Now, let me give you the honest, balanced answer to that, not the sensational one. Now, the Africa Centers for Disease Control and Prevention, that is African CDC, is closely monitoring reports of this hantavirus cluster and the MV Hondia situation. They're closely doing that. Now, South Africa has identified the Andes strain of hantavirus in 2 people who came off the cruise ship, making South Africa the most directly affected African country in this current outbreak. Now, for Kenya specifically, the current outbreak is not a direct threat. The Andes virus involved in this outbreak is primarily a South American strain. Now, Kenya does not have established Andes virus circulation at the moment. However, and this is important, Kenya does have rodents. Now, every country in Africa does. And where there are rodents, there is a potential for a rodent-borne viruses. Not necessarily hantavirus, but the broader lesson still applies. Now, the behaviors that protect you from hantavirus are the same behaviors that protect you from many rodent-borne diseases that are present in Kenya, including what we call leptospirosis. We have plague, we have a rat bite fever. These are rodent-borne diseases. So while Kenyans do not need to panic about hantavirus specifically, this outbreak is an important reminder that rodent control, food storage hygiene, and ventilation in enclosed spaces are not minor issues. They are life and death issues. Now, here is your practical protection guide from your pharmacist, of course. So if you live or work in areas with rodent activity, what should you do? If you live or work in areas with rodent activities, what should you do? Never sweep or vacuum rodent droppings dry. Now, this aerosolizes the particles. So instead, you spray the area first with a disinfectant solution, which could be a bleach that has been diluted in a ratio 1:10 with water. Then let it soak for about 5 minutes. Then wipe up with gloves and a mask on. Then seal the waste in a plastic bag and dispose of it. Wear gloves when handling anything in areas where rodents may have been. A simple pair of rubber gloves will do from the hardware store, and it can be the difference between infection and safety. Also, you need to ventilate and close spaces before entering, and open the windows and doors and let air circulate for at least 30 minutes before you start cleaning an old storeroom or a shed or an abandoned space. Also, you can seal entry points because rodents can squeeze through gaps the size of your thumb. They can squeeze through gaps the size of your thumb, and check your home for those cracks, for those gaps around pipes and openings under doors. You can use steel wool to stuff those gaps, which is an effective, cheap deterrent for those rodents. Now, store food in hard sealed containers as well, because plastic bags and cardboard boxes are not barriers for determined rodents. They can easily get their way through. So if you are traveling internationally, particularly to South America, what should you do? Now, the index case in this outbreak is believed to have contracted the virus during an outdoor activity in Argentina, including birdwatching in areas where rodents may have been present. So if you are camping, hiking, or spending time in rural areas in South America, wear long sleeves Avoid sleeping on the ground, and do not disturb rodent burrows or nesting sites, and be extremely careful when cleaning enclosed spaces like mountain huts or rural shelters. Now, at the ports and borders, this is what you should do. Now, port and health authorities, they are advised to apply appropriate infection prevention and control measures, including the use of personal protective equipment when caring for people with suspected infection. So if you are arriving from South America or from countries connected to this outbreak and you develop fever, muscle aches, and respiratory symptoms within 8 weeks of your return, please disclose your travel history to your healthcare provider immediately. That information changes everything about how you are assessed. I want to take a moment to step back from the immediate news and talk about what this outbreak really means beyond the headlines that we are all seeing. Because every major viral outbreak of the last 30 years, talk about HIV, talk about SARS, talk about Ebola, talk about COVID-19, Mpox, and now Hantavirus, has taught us the same lesson. A lesson we keep learning and keep forgetting. Viruses do not respect borders. Now, the MV Hondias left Argentina. Passengers came from 23 countries. The virus was confirmed in South Africa, and a new case appeared in Switzerland. Now, the ship is anchored off Cape Verde, which is in the western African coast. Now, contact tracing now spans multiple continents. One person, one birdwatching trip in a field in South America, and within 6 weeks, the World Health Organization, the European Center for Disease Prevention and Control, the African CDC, health ministries across 5 countries, and international media from every corner of the world are now involved. Now, this is the world we live in. A world where a virus discovered in a remote corner of Argentina can be in an ICU in Johannesburg within 25 days. That's the world we live in. And what does that mean then for Africa? What does that mean for Kenya? It means our surveillance systems matter. It means our healthcare workers need to be trained to think broadly, not just about the disease or diseases that are common in our immediate environment, but about emerging and re-emerging threats from anywhere in the world. It means that the investment in laboratory capacity, in rapid diagnostic tools, in trained infectious disease specialists is not a luxury. It is a national security. And it means that you who is watching this video are part of the solution, because an informed population is the first line of defense in any outbreak. When you know what to look for, you report faster. When you report faster, doctors respond faster. And when doctors respond faster, lives are saved. I hope you get that. Now, let me bring everything together for you. Let me wrap up everything and give you a summary of what I've covered in this video. Hantavirus is real. It is serious. It has killed 3 people on a ship in the Atlantic in the last month. It is being actively investigated by the WHO, the African CDC, and health authorities across 5 countries. But here is what I also need you to hear. The global risk from this outbreak is currently assessed as low. And this is not COVID. It does not spread through casual contact. It does not transmit through the air like influenza. Now, the Andes strain involved can spread between people, but only through close, prolonged contact, particularly in the early stages of illness. It is not spreading through markets, through public means of transport, or through communities. It is not. What you need to do right now is this. You know the symptoms that I've talked about: fever, severe muscle aches, headache, nausea, followed rapidly by breathing difficulties. So if you or someone found or around you develops these symptoms after exposure to rodents or rural environments, go to the hospital. Do not wait. Protect your home is another thing that you need to understand. As I've covered, seal rodent entry points, store food properly, clean enclosed spaces safely with disinfectant and protective gear, and also stay informed from and get information from credible sources, not just WhatsApp forwards that you keep on getting, not rumors. The WHO and African CDC and channels like this one exist to give you that accurate information. And share this video because someone in your network needs accurate information about this right now. They don't need panic. They don't need sensationalism. They need the facts, and you can only provide the facts by sharing this video. Then drop a comment below and tell me, did you hear about this outbreak before this video, and what questions do you still have about this virus, that is Hantavirus? I want to know, and I will respond to your question. Tell me what health topic you want me to cover next as well in the comment section. As we do that, please remember to subscribe if you have not already subscribed, and tap the bell, because the next outbreak, and there will always be a next one, I want you to be ready by getting accurate information from this channel. Dr. Libeya Bethwel, your pharmacist. Stay informed, stay calm, stay protected. See you in the next video.